Welcome back. This is the third video lecture on Chapter 49, Hazardous Materials. Moving right along, this video is going to be about establishing safety zones, and this is going to also rely on information found in that emergency response guidebook. You want to know the safety parameters for hazardous materials that are toxic and those that pose a fire or explosion danger. This can be found in that ERG. If you are dispatched to a hazardous material incident, protect yourself first. That's always number one. Protect yourself first, and then your team, and then the patients. Isolate the incident as much as possible. Don't let anybody get anywhere near it that hasn't already been in there. And that's not a HAZMAT specialist. The ERG can help determine your initial isolation distances. So you're going to go based on your spill or leak estimates or chemical exposure estimates. Look this up in the ERG and then find out your initial isolation distance. Notify your dispatcher of any other responders of the distance for isolation. Inform incoming responders of what you observe about the wind direction, terrain features, and a safe response route. And make sure you let them know where they're staging so you can maintain a nice egress corridor. So establishing your different safety zones, okay? Obviously your hazardous material is going to be found in the hot zone. Only trained rescuers wearing appropriate PPE are allowed here. This is generally your HAZMAT specialists, and they're going to actually go where the hazardous material is. If they would find downed victims here, so on and so forth, they would bring them into the warm zone. And then your operators and HAZMAT technicians that are in the warm zone are going to decontaminate those people that have been exposed, and then they'll bring them out to the cold zone. This is typically where you'll find your first responders like paramedics and law enforcement. Your paramedics are going to be triaging here in the cold zone as people are brought out to them, treating and then transporting patients. So you'll never have, if you're following this appropriate safety zone established guideline, you'll never have somebody who's contaminated in the back of an ambulance because your ambulance is out here in the cold zone, okay? Don't let your ambulance go into the warm zone or into the hot zone. And don't let somebody who hasn't been decontaminated, all right, be brought into the cold zone. The decontamination corridor should be a corridor within the warm zone, and patients should be decontaminated or deconned as they're brought out to you. So you should never have any exposure to the chemical. All right, that's the appropriate way to manage those scenes. The green section of that ERG, if you download it and use it as an app, it also has the color-coded sections. And that green section of the ERG provides the most accessible resource on evacuation distances. So there's a lot of information. We already talked about initial isolation and evacuation distances. It identifies and outlines predetermined evacuation distances and basic action plans for chemicals based on the actual size of the spill or an estimate of that size. And then your HAZMAT teams are typically equipped with a 4-gas. Your local fire departments might carry this. And it can tell you about explosive limits, oxygen levels, concentration of hydrogen sulfide, and the concentration of carbon monoxide. HAZMAT teams can determine the pH of spills, may have capability of specific agent testing using calorimetric devices. Computer-aided management of emergency response is one of many programs that help predict downwind concentrations of hazardous materials. It uses input of environmental factors into a computer model. So it puts in all these different factors of the environment into this computer model, and then it can help predict the size and the direction of the gas or the vapor clouds. So let's say chlorine is kind of the one that whenever you're hearing any kind of talk, discussion, lecture on HAZMAT, that's the big fear, the green cloud, the chlorine gas cloud, right? So if you were to use the computer-aided management or computer models to predict what's going to happen with that chlorine cloud, you would input environmental factors and wind speed and all of that, and it would actually give you a lot of information on what's going to happen with that chlorine gas cloud. PPE. All right, you want to be familiar with the personal protective equipment used at a hazardous material scene. I'm going to go over a few different types of PPE. Usually the hazardous material team or trained responders will determine the appropriate PPE needed for a specific incident you should recognize certain levels of or combinations of PPE and hazardous, considering hot or cold related issues, potential health risks of exposures, how to treat an exposure, so on and so forth. Protective clothing is classified as level A through level D. So your level A ensemble, all right, it's going to look like this. All right, and a lot of paramedics get trained to this level where you're wearing this level A suit. It provides the greatest respiratory and skin protection, covers the full body, and self-contained breathing apparatus. So this would be what your specialists are going to wear. The suit itself, this suit is you're going to see throughout the different levels. Okay, but the full level A ensemble will actually have SCBA, which is what the firefighters, respiration tank, whatever you want to call it. It looks like a dive tank. That's what SCBA is. They'll have their mask, their SCBA tank, and everything within that suit. And this is your best protection right here. A level B ensemble is used when high level of respiratory protection is needed and there is no threat of skin absorption. Okay, so this is going to provide you with pretty good airtight seal, all right, but this suit isn't going to provide as much protection as far as corrosive or acidic type chemical were to come in contact with it. It's not fully encapsulating. It's worn with SCBA or supplied air on the outside of the suit, and usually worn by responders who are performing decon. Here's your level C ensemble. All right, it's designed to protect against a known substance, provides minimal splash protection, worn with an air purifying respirator, okay, or a PAPR, which is a powered air purifying respirator. And that's not SCBA. It doesn't have contained air or oxygen. It's like a filter, okay, and it powers. You can either be powered or not powered, and you're not going to go into your very bad hazmat incidents wearing this. This wouldn't be any further than a decontamination site, and you should know exactly what type of hazardous material is involved while wearing this. And you should be following the trend. Obviously, level A is the most encapsulating ensemble. Level B is just below that. Level C is below that, and then we have level D, which is pretty much nothing, right? It's worn when there is little to no threat posted by the substance, no respiratory protection whatsoever. And you're gonna not wear this anywhere near anything that can have any type of hazard to you through respiratory cause or through skin irritation. This is strictly cold zone stuff. Moving on, the NFPA does not certify any garments, so there's no clothing that's going to be certified by the NFPA. Certification is a common misperception in the hazardous materials and weapons of mass destruction response industry. The intent of the NFPA clothing standards is to provide guidance on manufacturing quality and performance standards. So the NFPA doesn't actually sell any of this stuff. Standards are performance documents for the garments only. They are not intended to guide responders. So as they make these ensembles for you, level A and level B ensembles, they're following NFPA standards, but they're not necessarily certified. And then we have HAZWOPER, as I mentioned in the first video lecture. OSHA's HAZWOPER regulation offers guidance on which level of chemical protection to use under specific conditions. So whether you're going to need a level A or level B suit, depending on that different situation. Conditions under which the various levels of protection should be chosen. All right, so the HAZWOPER courses, they will help you determine which level suit you want to wear in each different situation. Contamination and toxicology. Hazardous materials getting into the body and interfering with the body's processes. All right. The harm caused by a hazardous material is affected by the following: the route of exposure, the dose and concentration, how long the toxin was in contact with the body, whether it exhibits acute or delayed toxicity, if the patient has a chronic pre-existing condition. All those things can affect how harmful the hazardous material is. Okay, so the route of exposure makes sense, right? If it's a chemical that you ingest, it's usually not a good thing. But sometimes chemicals that, just make contact with intact skin aren't that bad. They could be, depending on the chemical, but that could be a situation where the route of exposure is worse, depending on whether it entered in through a body cavity, so on and so forth. Again, primary and secondary contamination. Primary contamination is direct exposure to a hazardous material. Secondary contamination, hazardous material is transferred to a person from a person or contaminated object. So this is why you don't want anything that hasn't been decontaminated brought into the cold zone, because you could have secondary contaminations, right? Routes of exposure. Your 4 primary methods are ingestion, inhalation, injection, and absorption, right? Similar to routes of medication administration. You have a local effect, which is reddening of the skin. This happens with a lot of irritants, okay? Localized pain, blisters, all right? Blisters are a pretty bad sign. You could have a systemic effect, which the damage occurs inside the body, and it affects all your different body systems. Usually we see this through various signs and symptoms, but your vital signs can change depending on the type of chemical involved, so on and so forth. Your record should include, when you're documenting, elements required by the authority having jurisdiction or medical director, description of the scene, anything you were told about the substance, how your patient looked initially, treatment rendered, positive or negative changes. And finally, the dose effect principle is the greater the length of time or concentration of the material, the greater the effect on the body. That makes sense, right? So the greater length of time or concentration of the material, so if there's more of it or you're around it for longer, you're going to have more of an effect. So the first step is to get away from it. If it's inside a building, it's some sort of gas leak, get outside, away from it. And try not to be exposed to too much for too long. The cycle of poison action includes absorption into the body, delivery to target organs, binding to those organs, and then biotransformation and elimination of the toxic through the gastrointestinal tract, kidney, or respiratory systems. All right, so this is the final slide for video lecture number 3, and we'll continue on in the next video lecture following this one.